Governor Kevin Stitt ordered an independent review of the Department of Mental Health after local nonprofits were sent confusing information about their contracts from the department. Thanks so much for joining us tonight at 6. I'm Naomi Kitt. We covered the story as it happened, being told over and over all day on Friday by those nonprofits that their contracts had been canceled. Until that evening, when they said that was no longer the case. 2 News Oklahoma's Emma Birch looks into who could suffer from a mix-up like this.
A community is only as good as the way they treat their most underserved.
Dustin Bailey was once a client at Grand Mental Health Addiction Recovery Center.
I knew this facility was here, and fortunately I had built some relationships, and those relationships allowed me to get in the doors a lot quicker than you could normally. Today,
Dustin got out of the Addiction Recovery Center and he wanted to go back in, not to be a client, but to help those who are in the same boat as him.
And given an opportunity to hopefully impact somebody's life, including mine.
But now Grand Mental Health, Family and Children's Services, and Cree Oaks are all in the unknown after receiving a letter Thursday that their contract with the Oklahoma Department of Mental Health and Substance Abuse Services were coming to an end May 10th. I spoke with the CEO of Grand last week, who said the Addiction Recovery Center would likely be impacted.
We're going to have to be looking at different ways for them to receive care.
Something Bailey said is concerning for all of Tulsa County.
Scary. You know, Tulsa has an amazing recovery community, and it's all kind of centered around the fact that this campus exists. And without that presence, a lot of people are scared. A lot of people are worried for their loved ones, for their, family members, for their friends.
But Friday, the ODMHSAS sent out a statement saying there was an error sending the letters out and that the termination of the contract date is now at the end of June. I called
immediate contact lines
and emailed both the Office of Management Enterprise Services and the Oklahoma Department of Mental Health Substance Abuse Services on this matter. OMES hasn't responded. ODMHSAS responded but told me they cannot comment on this matter. Governor Stitt said he is not cutting the programs completely, just moving to what he says the $800 million will now go towards more cost-efficient programs. For Bailey, he hopes the state and the mental health clinics can resolve this matter quickly to save thousands of Tulsans' lives.
The decision that you want to get treatment is critical in saving lives, and the inability to do that will ultimately cost somebody their life.
Reporting in Tulsa, I'm Emma Birch, 2 News Oklahoma.